CDC came out with those, and we had ours updated, the next day, the next morning. It's a substantial change, and one that it takes a lot of adjustment. We went from 10 days to 5 days for both isolation and quarantine. And when I met with the case investigators, one of the things I wanted to make really clear is we lose our public health intervention piece with this. So by the time one is symptomatic and then tests, and we get the results within 24 hours and we're calling, that 5-day time frame is
Yeah.
usually pretty close or up. And so the limitation and the challenge is that in this guidelines, it's really important that people are not leaving the home when they're sick. And even if they have reduction in symptoms, we made our guidelines a little stricter in that one has to be symptom free. And so there's still a lot of studying that needs to be done, a lot of information we need to be able to see. But this time for us, the symptom free was important, although CDC says improvement in symptoms. So that was an important thing for us. But when we talk to people, one of the things we tell them is it's important for you to understand they only did this with the caveat of wearing a mask for an additional 5 days, staying home, if you continue to have symptoms, and then testing for those who are contacts at that 5-day mark is incredibly important. It's a best practice. It's not required, but that way if you have COVID-19 when you are released from quarantine.